Perfect. You have someone named Jermaine Simon. All right. Hello, this is Dr. Orlando Landrum with Dr. Michael E. Jackson from Regenix Des Moines, coming to you guys live to talk to you about regenerative medicine, give insights and understanding about the Regenix way, and also, more importantly, the Dr. Michael Jackson way, about how to be able to treat regenerative medicine, how to be able to treat various different conditions using regenerative medicine, and really provide value to you as a patient, as well as getting you back on your feet, punching pain in the face, and getting you back to doing the things that you deserve and love to do. So one of the things that we want to kind of do is give a background on Dr. Jackson, who I'm privileged to have here joining us today, as we kind of bring this aspect into understanding and really give some insight. So let's see what we can do about bringing you in and having you understand what it is that we do, and have you as understanding about how we do different things, and bring Dr. Jackson in to be able to answer questions as we kind of move through. Dr. Jackson, thank you so much for joining us. You don't mind if I embarrass you a little bit and kind of give some background on you, do you?
No, I'm okay with that. When you said it, I knew we were going down that road. So
there you go. All right. So Dr. Jackson is from Michigan. He played football in high school at Flint Southwestern. Oh, we're going back. Yes,
we are.
Yes.
Oh my goodness.
And then that aspect of athletics kind of got you involved with looking at various different teams in orthopedics, as we understand it. Particularly at the time, they've gone back and forth multiple different times, but LA Rams, and the surgeon that was affiliated with the team that really was very influential to your thought process. You continue playing football in college at Albion College. And as I understand it, you graduated in 1985 with a bachelor's in biology. And then following that, you did an MD at Michigan State. And as we know, we won't go into depth in detail because there's a lot of rivalry between Michigan State and U of M and Notre Dame and other things like that. But I think for a period of time, you might even had a dog that was named Spartacus. I don't know if it was related to the Spartan component.
Spartan. Okay. I love Sparty, absolutely. And he loves the Spartans.
All right. So continuing on, you did residency in physiatry, which is physical medicine rehabilitation. And also, as I understand it, really had a focus in the context of electrodiagnostics, which revolves around components of being able to evaluate the aspect of how nerves function in terms of our body and how it connects to our muscles and everything along those lines. Yeah. But you've been doing regenerative medicine for quite some time, and really have been a pinnacle figure in utilizing regenerative medicine to be able to aid and help people be able to get better. So within that context, we really want to kind of pick your brain and provide value to our viewers and our listeners and patients, so that they have an understanding about what regenerative medicine entails, how it's impactful, because we hear a lot of different stories that are out there. And I mean, you've been doing this so long that you've been on a number of different news stories and various different pieces that are in place. And they sometimes get these local experts that want to try and talk about regenerative medicine, not having done it, not having done research about it, but then they'll quote the elements of things like the FDA, and not knocking the FDA. But as we know, we're getting various different stories that are coming from multiple different constructs in regards to other health issues right now within the context of COVID and the pandemic. Absolutely. So one of the things that we really want to kind of put forth is sometimes really getting it from the proverbial horse's mouth, the people who are on the front lines that are doing it, whether you're anesthesiologists and nurses in the ER and operating rooms in certain contexts, or if you're doing regenerative medicine and you're seeing what's successful and what's not successful, and being very candid with patients. I think that's what really people want to hear, is I don't want you to shine me on and tell me something that's not true. And we know that's not your style, but you'll let the viewers and listeners know that in just a second or so. But we really want to have an understanding. So Dr. Jackson, what's your unique approach to regenerative medicine?
You know, I was thinking about this prior to doing the show, and what came to mind was, you remember the old Smith Barney commercials? John Houseman, who was an actor, it was early 80s. I think if you saw the movie paper chase. He was a professor, but he used to end those commercials with the saying, Smith Barney, they make money the old-fashioned way. They earn it, right? Well, I'm not talking about the earn it part, but I practice the old-fashioned way. What has amazed me is the number of patients that come through here, because it's usually a second opinion. They've seen an orthopedic surgeon, they've seen a primary care physician. Now they're looking at an alternative form of treating this musculoskeletal or neuromuscular condition that they have. And obviously I get a thorough history, and it amazes me how often they're not listened to. The history isn't obtained. And you have to listen to the patient, because going back to my background, physiatry, we pride ourselves on the ability to obtain a very good history. And after I've obtained that history, I pretty much have a really good differential diagnosis, or a list of the top potential diagnoses. And my focused physical exam should get me right there, should hone in on that problem. And so I spend a lot of time. I practice the old-fashioned way. I'm going to obtain a very complete history. I'm going to do a very thorough physical exam, and then we're going to have a long conversation. I spend an hour with each and every one of my patients. And oftentimes they're amazed that I actually have that amount of time set aside for them. But I can't do what I do by allowing an image to dictate my treatment plan. I can't throw up an MRI. I can't throw up an X-ray. Yes, it helps. It starts the story. The images start the story, but they do not tell the tale. I'm going to get the tale from the patient. I love to listen to the story. And again, that's kind of old-fashioned. They are sometimes surprised that I'm asked. Yeah. I got you. I got you.
Before we let you keep running, because I think back in the day, you might have played linebacker and running back. So you might run a little bit. So we got to stop you before you get too much yardage here.
You better believe it. Oh, I'm passionate about what I do.
Let's roll it back just a little bit.
All right.
And ask you the following question. And so for some of our viewers and listeners, they are new to regenerative medicine. Can you explain what regenerative medicine is? I know your style of practice certainly is that old school component of like, let's sit down, let's talk, let's understand your why. Let's get that component of figuring out, let's not just treat you for your body part, your knee, your hip, your elbow, your shoulder, but understand what you're trying to do. I get that. But give us an explanation about what regenerative medicine is, and then put your overlay of context of how you kind of put your own style to it.
So regenerative medicine, the way I explain it to my patients, it's the use of natural healing. Basically, we all have the ability to self-repair. The definition of life is self-repair. As long as you're living and breathing and blood is running through your vessels, you're going to self-repair, right? If you cut yourself and bleed, it will take care of itself. We're just going to take those same cells, channel your body's energies and abilities in the right direction with those platelets or stem cells to get repair of tissue, and in some cases, regrowth of tissue. And so in my practice, as you mentioned, I'm PM&R with a fellowship in sports medicine. So the bent is on strains and sprains and bumps and bruises and things like that. Again, accurate diagnosis of the condition, and then injection of your cells, either stem cells or platelets, into that tissue, precisely placed via guidance, either ultrasound guidance or fluoroscopically guided, into that tissue, and allowing the body to do what the body does. The body self-repairs. As long as we do the right things, avoiding ice, avoiding anti-inflammatories, and employing relative rest during the healing period, we should have good repair. And we have great success doing so, as you very well know.
Okay, so with this, you know, there's a number of docs that don't have an understanding of regenerative medicine. They just don't. Whether it's primary care doctors, whether it's orthopedic doctors, whether it's anesthesiologists, physiatrists even, right? And sometimes we have these misconceptions that because we don't experience it, it can't possibly be real. Right. I know I've spoken to a group of docs at one point in time, a number of years back, and they're like, that regenerative medicine stuff, that's hogwash. It's people selling snake oil. Can you give us an understanding? So, because patients are conflicted, they hear about this from multiple different sources, how people can be able to get an understanding about what's true and what's not.
Well, I always tell them to go to the internet. There's a ton of information. You can Google, do a Medline search if you choose, and look at the research. The research has been very good. Regenetics, we do a ton of research that has proven that we can self-repair. And so when I hear that, which I hear often, I ask people, if you cut yourself and bleed, do you heal? Because I hear it all the time. Well, my surgeon said that doesn't work. That's poppycock, and you're selling snake oil. Not true. I have before and after pictures to prove it if you want to see them. But most importantly, if you have the ability to self-repair, those cells aren't going to turn themselves off when we place them in damaged tissue. And so once I explain it in layman's terms, because it's really pretty simple. Um, I start off with a 7.5 minute video that they watch before I walk into the room. This explains natural healing. And once they've seen that, I just kind of build on it. And people understand it by the time they walk out because it's common sense. I mean, again, how many times have you cut yourself and bled and it repaired itself? It healed. You're not walking around with tons of scars from your childhood that never healed. And so those same cells have the ability to repair the tissue that you've been told may not be amenable repair with stem cells or platelets.
Okay. So, just as an aside, we have a couple different comments that are coming in. I can't take credit for this, but one of our listeners, Mr. Jesse Valdez, is saying, I like the way you both make this Regenix procedure easy to understand, along with simple English words. Thank you both. So, I think you pride yourself on really being able to make sure that you can be able to make this be approachable. And it's funny because, and I'm not trying to knock other docs, but sometimes people come in on a high horse into a room, and we other docs will use fancy terms, and the patient is like, what did they say? I don't really understand what I'm supposed to be able to garner from this. And when you talk about doing things like this, you really have got to be able to break it down and be able to make it so that people can understand what are they getting themselves into and can be able to understand going forward.
So incredibly true. And honestly, I credit a lot of my success with the ability to do that. And I have to go back to my upbringing. I'm from Flint, Michigan, bro. I'm from the hood. And the King's English, or Queen's English, or whatever it is I'm speaking right now is my second language, right? Okay. Uh, Ebonics, I guess is what it's termed now, is my first language. And so I realized that I can't talk over your head. I'm never going to talk over your head if you walk into my office. We're going to talk like real people, and you're going to understand exactly what I'm saying. That's what the video is all about. I'm not going to use these big fancy medical terms. Me and you may do that, but I don't want this to fly over people's head because they may miss out on an opportunity. And I pride myself in the ability to articulate fairly well in a manner within which everybody can understand exactly what we do. Natural healing, because it's the future of medicine. And I have been so incredibly excited about my opportunity to be a part of this because I am able to provide more relief for my patients now than I've ever been able to. And, I've been practicing for a while. I think you may have mentioned some numbers in there in terms of my graduation dates. So, I've been practicing medicine for over 20 years. And I've never been able to provide the kind of relief for my patients that I can now.
So, quick question about that. And we have a number of questions coming in from some of our viewers, some of which I know pretty well, and they're going to want their questions answered with quickness. But
then they might be talking to the wrong brother.
But to set the stage is the following. So what got you started in regenerative medicine to begin with?
Well, that's a good question. Kind of dumb luck, quite honestly. So I spent 7.5 years. I came out of private practice and went into corporate medicine. I was working for Delphi Corporation, which was the auto parts supplier of General Motors, and they had just gotten spun off. And so I had this incredible job and loved doing it for 7.5 years. But then I got promoted to the point where I was sitting behind a desk, and that is not me. I got to have my hands on people. I got to treat people. And so I left corporate medicine and went into private practice. And when I did so, I decided I was going to find what's the latest and the greatest. And the first thing that I did was I took an ultrasound course. And during that course, I ran into or met one of the providers in Regenix, Dr. Cranberg, to be exact. And he mentioned that I should check out prolotherapy because this was up and coming. And so I did. I took a prolotherapy course right after the ultrasound for diagnostics and guidance and was enamored. I was hooked. And I went right home after the prolotherapy course and bought a PRP machine. And this was back in 07, latter part of 07, 08. And I was one of the first in the state of Iowa to start doing these ultrasound guided injections and platelet-rich plasma, but was having tremendous results. And the company, actually, I think it was Insight at the time, wanted to train me in stem cells. But relationships in Cedar Rapids kind of fell apart, and I found myself over here in Des Moines, and another group found me. And that's how I got into the Regenix side of it. But I was practicing what would be considered regenerative medicine with prolotherapy and platelet-rich plasma from 07 to 2014 prior to joining the Regenix network. And it was just, having tremendous success.
So to that end, let's make sure that we have people have an understanding about how to be able to kind of connect into you and your network. So as I understand it, Regenix Des Moines is where you're located. The
Yes,
phone
sir.
number is 515-219-7864 for any individual that's looking to be able to reach out to you to Des Moines. We'll pop that up on the screen, a number of different times for those people that are in kind of that aspect of Iowa, Illinois, other areas that they should travel from, Alaska,
Missouri,
Hawaii, wherever, to
Minnesota.
come get your, yes, Missouri, to
Sir,
come get your degree of expertise. All right. So let's kind of move forward with this. So let's say that you had to kind of give a few word synopsis, an elevator pitch of what regenerative medicine is for someone who's just walking in. They're like, you know what? Define that for me a little bit. What does that entail? What exactly are you using? Is it stem cells? Is it PRP? What does it really entail?
both PRP and stem cells. So again, going back to the way I explain it, if we're treating mild conditions, mild arthritis, or strains and sprains, partial tears, scar tissue, laxity, I'm going to use platelets. Platelets will heal tissue that exists. So we're going to extract those platelets out of your blood. Kind of goes back to my 7.5 minute video, right? Because I define natural healing. Natural healing is when you bleed. There are three components in the blood, essentially: red cells, white cells, platelets. Red cells carry the oxygen to fuel the reactions that occur. White cells fight infection because that inhibits healing. And those platelets coagulate, right? They stop the bleeding, surround or wall off the area to protect it, and then they go to work after creating their little construction site and repairing tissue. And so that's what we're doing. We're channeling the body's energies in the right direction, or the body's capabilities, taking that ability to heal, taking those cells, concentrating them, and placing them in the damaged tissue with respect to platelets. Now, if you have a more advanced condition, for example, like me, I'm a patient. I'm bone on bone in my right knee. I'm a total knee candidate. No one will ever cut my knee out because I'm 90 to 95% improved after a couple of stem cell injections and multiple platelet injections. But I'm hard headed because I don't stop doing what I do. I don't follow my own directions because I get injections for free. But for stem cells, we're talking about lost cartilage or full thickness tears, and it will grow tissue. So if I need to grow tissue, I'm going to use stem cells. If I need to just repair tissue that exists, we're using platelets, but they're all yours. They're coming from you. We take the stem cells from your bone marrow. We take the platelets from the blood, and it's re-injected after a process, the Regenix process.
Okay. So, to that end, what are some of the conditions that you feel like have exceeded even your expectations? And you're like, wow, this is a pretty darn good result.
I'll tell you, the first time I did an ACL injection with stem cells and to see that grow back.
I'm sorry, hold on a minute. I understand this very well, but you're just speaking like out of the blue. People are like, ACL? Wait, you
Hey,
can fix an ACL? Why don't you tell us a
sir.
little bit about that? ACL,
Yes,
normally
sir.
that's surgery tear. That's something
Yes,
that,
sir.
football player, running backs, Adrian Petersons and other people are going to have to rehab for multiple times. You can fix an ACL? This is malarkey. This sounds like Star Trek and Star Wars. Tell me what you got.
Stem cells is what I got. Well, you have stem cells. I have the ability to extract your stem cells and precisely place them into that torn ACL. Now, we have criteria. You can be too far advanced. You can have too much displacement. Let's see if I can get this right. So, femur on top of the tibia, right? If it's too far displaced, it may not work real well. But if it's in a good position and some of the ACL is still intact, then we can get it to grow back. And I've had great success with that. I've had the same success with rotator cuff full thickness tears. To see that supraspinatus a year later look pristine is incredible. So that's probably been the biggest eye opener. And then I have some other body parts that I treat because I tell my patients all the time, I treat everything from your shoulder to the tips of your fingers, from the hips to the tips of your toes, and sometimes some places in between, like the SI joint or the sacroiliac joint. And if you look at my results for plantar fasciitis and Achilles tendinopathy, we're above 90, we're approaching 90%. And I think one of them is 90%, but everything else is pretty much 75 to 80% positive outcomes. I treat a lot of knees, a lot of hips and shoulders, a lot of elbows, a lot of tennis elbows, golfer's elbow, and they just respond really, really well. That's another area that really responds well. I was actually getting insurance coverage for elbows when I first started doing this back in 08 and 09 because there was no other good alternative to treat that condition. And what we're talking about is tendinopathy typically. That's the other thing that I have to explain to patients because the hip, for example. People will come in and they'll say, I've been told I have bursitis. You don't really have bursitis. What you have is tendinopathy of the glute muscles, gluteus medius and minimus, which insert there on that greater trochanter. And what is tendinopathy? The third phase of tendon pathology. Tendinitis is acute inflammation. Tendinosis is chronic inflammation. And then if it's scarred, frayed, because it's been damaged for quite some time, then we call that tendinopathy. And I see a ton of tendinopathy and I treat it all day, every day. And it responds extremely well.
Okay, you are putting this down like this is a jazz concert, like a rap battle. I mean, we're here explaining everything in full detail.
I'm trying to pack it in. Hey, we're trying to get it in.
23 minutes into the conversation here. People, if you are finding value, hit like, give us a heart. Let us know that this is going well and that you are finding good value with this conversation, please. So one of the questions that comes in from another individual talks about what are the projected lengths of relief that you have so far, which is a phenomenal question, because some people, particularly other docs, will say, oh, yeah, but it's like a steroid shot. It won't last long. Yeah, I'm going to give you your pulpit in just 1 second.
I'm doing my Matumbo.
Yeah, I know, right? You're dating yourself a little bit there. But so we're going to let you kind of like give some understanding about, so is this a quick fix? Is it like viscosupplementation, like Synvis, like steroid? Or how would you say this kind of compare?
Really good question. I'm asked that often because people assume after I've given them my spiel and talked about the treatment plan that this is just a temporary fix. And this is just to keep me or delay me going to the surgeon. No, this is not a delay. We are hoping to keep you away from the surgeon's site. We want to repair tissue. I'm not going to inject a steroid, and we know, and hopefully everybody that's listening will now know that steroids are one of the worst things you can put in your body. They cause apoptosis, which is a fancy term for cellular death. Don't kill tissue. Doctor, do no harm. I remember that. I remember reciting that, and I believe in that. And so I'm not going to hurt you. I tell my patients all the time, I will not put a steroid in you. If you want steroids, you need to go across town to somebody else who is willing to hurt you. I'm going to repair tissue, and this is not a temporary fix. Now, if you're younger, right, and an athlete, I'm probably going to see you again, right, because you're going to have some strains and sprains and bumps and bruises. But oftentimes I'm seeing the more mature population, the more mature demographic, the 60, 65, maybe 70. The young lady I just injected is over 80 years old. And she is a one and done. She just wants to get her life back. She wants to be able to walk up the street with her dog. She wants to maybe play with the grandkids or the great grandkids. So we're repairing tissue, and hopefully it is the final step for you. You don't have to come back and do anything else. It's not temporary. Repair, regenerates.
So what is your favorite type of patient? And can you list a patient that's touched your heart and you said, man, I'm so glad they got a great result?
Oh, probably my favorite patient, it would be the demographic. Well, two. Women tolerate pain better than men do. And I prefer to inject women, especially more mature women. It just amazes me how comfortable they are.
Don't pander to the crowd now.
I'm sorry. I'm keeping it real. So that number one, but I like an educated patient. I don't know that I have any specific body part or attitude that you can come in and make your favorite patient. I want you to be educated. I want you to do the research. I don't want you to listen to what I have to say. I want you to go and research what I had to say and what the doctors that you saw before you had to say, and then we can have an educated conversation. Those tend to be the best patients. They also follow instructions better because they come in knowing that there are some limitations that we're going to have to employ in order for this to give you a good outcome, this form of treatment. So, but I have some body parts that respond well, and I like that. Yeah, I see a lot of triathletes. This is an area where triathletes come to train. A lot of trails, a lot of bikers, and so you just put up Frank. Frank's a marathoner. We helped him get back to running, and he was very grateful. He's been a great mouthpiece for the practice.
Within that context of being able to talk about having super high endurance athletes and individuals that kind of push themselves, this has really become quite a thing. And I think it's been a blend of that. Some things that we've seen from video casts that have tried to be as good as ours. People like Joe Rogan and other individuals, right? But they have talked about, the aspect of regenerative medicine. But many people have really done athletics, where they've pushed hard, either as a weekend warrior, as one of the hobbies that they have. And we know that you have this Incrediwear brace that you have on here. And we just had the CEO from Incrediwear just last week on our
Jack,
channel kind of talking about this. Yeah, really good guy.
Great guy.
Can you give us some idea about those people who want to continue to be active, that aren't just looking to get their pain resolved, but say, you know what, I want to go live life? Is this something that might be a fit for them too?
Absolutely. And I see a ton of those folks, bodybuilders, soccer players, guys that have, or guys and girls that have played sports in college and want to continue to play, just like me. I want to be active. I want to compete. So absolutely. And as you know, and I'll share this with the audience, a lot of us in the network are former athletes, and we keep ourselves moving. You heard me talk about all the injections that I've had. Yes, this can keep you moving forward. One of the things that I've been very impressed with is those individuals that have had pain and been told that there's not much that they can do about it. They were former athletes, they were in great shape, and now they've gained a lot of weight because they can't exercise due to the pain. But when we get rid of the pain, relieve that, and they're able to get back out and do what it is that they enjoy doing, the weight loss that we've seen has been tremendous. And I've always felt that we should be partnering with primary care physicians to help treat the metabolic syndrome, so hypertension, hypercholesterolemia, hypertriglyceridemia, because they're eating improperly or they're not exercising. And it's because of pain. And oftentimes they don't have a good alternative for them to get out of pain, other than medications, which we kind of frown upon here, or steroid injections, which is going to weaken the tissue and advance the condition. So absolutely, this is definitely something that is becoming more mainstream, actually, and not just in the weekend warrior, but in the professional athlete. We treat a ton of professional athletes in the Regenerative network successfully.
Okay, so since you put that, we can't have you name dropped, I know.
No.
However, you can refer to various different leagues in generalities. So if I reference kind of my background research as I understand it, you have actually been a team doctor for a number of different colleges. I want to say about 3, but you also were a team physician for the NCAA men's basketball tournament, and supposedly also for men's Frozen Four hockey as well.
Absolutely. I love hockey. I love hockey.
You're from Michigan, yeah, we know. So,
I can even ice skate and handle a puck.
All right. So 3 visits ago, maybe 7 visits ago, we had one of our gentlemen that was a really big time hockey player and coached hockey in college. But be that as it may, I have a number of questions that are coming in. So we're going to have some of our viewers' questions kind of supersede my own. So one of the questions that's been posed is if a patient is on pain meds and you do this procedure, what are the steps that you personally would do to stop the meds, continue the meds? How do you handle this before you go through the aspect of doing regenerative medicine? What's your style of practice?
Well, it depends upon the medication that we're talking about. If it's an anti-inflammatory, it has to be stopped. And we have information that we provide them on alternatives. We try and get them off that med because it interferes with the function of the platelets and the stem cells. If it's a pain medicine, a true pain medicine, then I will typically collaborate with their physician. If it's necessary, then they stay on it. And oftentimes, if you're getting prescriptions for pain medication, you're also on a pain contract. So I can't prescribe anything. Again, it makes it important that I collaborate with that physician to make sure that we have something for them post-injection, because that's an issue for the first 24 to 48 hours. You're going to have pain, and we're going to have to medicate that. So I sometimes write on that, right? I let the patient I just saw, for example, I don't have to prescribe her anything. Her doc's taking care of that. Now, I won't stop your pain meds if it's legit. If I recognize that there may be an issue, then I have some referrals that I can make to folks that can help you with your pain management.
Okay. So what's one of the most curious areas or nooks and crannies in regenerative medicine that you're most interested in right now?
That I'm most interested in? Probably cartilage regrowth. And that's selfish.
Don't just pull that. That's great, because that selfishness, I think, is valuable to a whole host of people. Tell us a little bit more about cartilage regrowth and your thoughts.
Well, I know expound on it much, but I know that that's where we're going. We're going to be regrowing cartilage someday. Right now, we're repairing it. I'm looking forward to that day, hopefully, because I need cartilage in my right knee bad, very bad. So I'm just kind of watching it from afar, not really getting involved in any research. Just I'm a doer. So when I see it pop up and it's available, I will employ it in my practice. And I hope to be able to do that sometime in the near future.
Okay. What's a common myth about regenerative medicine that's there, and can you debunk it for us, please?
The most common myth is that it doesn't work. All right, it's poppycock that you can't regrow tissue. I heard this at a conference. I think you and I were both in attendance. Um, a professor or a physician from Harvard. I don't know. I think somebody on this call is a Harvard trained physician.
Really?
But
Okay. This is going to become it's going to devolve between a Detroit-Chicago battle in just a minute or so.
I see.
Keep this at a high level, but continue.
But I heard this physician on stage tell the audience that you can't regrow tendons or you can't repair tendons with platelets or stem cells. And I was shocked that she would make that statement, in that group of physicians, and nobody challenged her, because I have before and after pictures that it does work. We can regrow tissue. We can repair tissue. Tendons respond extremely well. As I mentioned previously, tendinopathy is one of the major conditions that I treat on a regular basis. Every day I'm treating that. And it responds well. So that it doesn't work, that it's temporary, that's the biggest myth.
Okay.
And I'm living proof of that. It does work.
Quick question that comes in is, has this helped people with disc herniations? Can you comment on that?
No, but I bet you could. So, I don't do spine, and I've seen the pictures. I've seen the before and after. So I would say, yes, it works, but I'm going to have to defer to Dr. Landrum on this one.
So what I would say is that we know there are studies that have shown great degree of benefit throughout the spine, both the cervical, thoracic, and lumbar region. And there's multiple different areas that can be treated, not just the aspect of herniation. If I was really going into depth and detail, what I'd probably say is sometimes, much like you'll have a problem with your knee, we sometimes will focus only on the knee. And it's not just the knee alone. And that's one of the best things about regenerative medicine and Regenix as a whole, is what we'll do is we'll look at that knee, but we'll say, why did you have the problem to begin with? Did it come from you having some hip imbalance? Did it come from you having a back problem that caused you to have the gait? Because that is actually influential to you having this issue with the knee, right? So you may have knee pain only on the inside of your knee, right? And there may be multiple different reasons for why that's the case. So by the same token, we talk about back and leg pain. What we will typically do is focus on just the aspect of the herniation. But we know that there's new things that are constantly coming out that make that back pain and leg pain more nuanced. As of probably the last 2-3 months, there's some interest in modic changes and how it's actually impactful on the axial spine, much more so than what we originally believed. And we don't think that disc may be only the issue alone. But we're not here to listen to me talk. We're here to listen to Dr. Jackson talk in depth and detail about his degree of expertise.
Well, you brought up a really important point, and that is the approach that we utilize with Regenix, but that everybody should be utilizing, and that is looking at biomechanics, right? When we have pain, we develop different postural patterns. We change how we sit, how we stand, how we walk. And it's important that we address all those. So I can inject your tissue, I can make your tissue normal, but if your gait is off and it's breaking down tissue because it putting too much stress on one body part, then we have to address that. Otherwise, again, you're not going to have a very good outcome. And I employ a specific type of therapy post-injection to make sure that is addressed. So good point.
Okay, so what should patients ask about regenerative medicine, whether they're talking to yourself or they're talking to me, or God forbid, some other doc that may not do it to the same degree or extent, perhaps not. What would be the question that you should grill your doc about? Because really, as you mentioned before, you want that informed patient. You want that patient that has an understanding of what's the value. So what should they be asking?
Well, I always think it's important to understand the process. I mean, I tell patients all the time that what sets us apart from other networks is our process. So I was doing PRP when I first started, which is your normal concentration of platelets. We know from the research that super concentrated platelets works better in certain body or tissues, like tendons, like 5 to 7, and meniscus 10 to 14 times normal concentration. So that's really important. Do you concentrate? 1. 2, do you inject under guidance? Are you injecting blindly? Because we know it's extremely important to precisely place the platelets or stem cells into the damaged tissue. If you put it elsewhere, it's not going to magically go seek out your pathology. So those are probably the two biggest. What process do you use, especially with respect to stem cells? Even more important than I think the platelet process. Are you taking stem cells from bone marrow? Are you taking stem cells from fat? Are you counting your cells? Do you know the concentration of the stem cells that you're re-injecting into the body? Those are really important because they lead to better outcomes. And so that's what I tell people as the details about the process.
Okay. So really good, like nitty gritty information that allows people to be able to dig in and ask some of these questions, for especially that's not really well represented in a lot of different places. But certainly with Regenix provides value in a couple different aspects. So for those of you who are watching right now and you are actually feeling like this is providing value, by all means hit like and hit the heart button to say, yes, this is something that you really find value. If you have interest in learning more about PRP and stem cells as a whole, definitely subscribe and take a look at our YouTube channel where we give further information about breaking down PRP, the differences in PRP, what's the concentration, all those type of things. So, and if you're interested in, again, being able to make sure that you have some degree of value and that you can be able to improve yourself, and you're located in the Iowa, Illinois, Missouri, and
Minnesota,
Michigan area, since he has kind of the build from Michigan, but we're going to fight about that Michigan area since I'm in Indiana too.
we're going to collaborate. We're going to collaborate.
What we're going to talk about looking at is Regenix Des Moines, which is at 515-219-7864. So, to go on with us talking a little bit more about this, one of the questions that came up from one of our audience members who is very involved, and I like it, is the following: so would age play a factor? What is your commentary on that? And can you give us some?
We know from the research that we don't heal as well as we age, which means our cells may not work as well. But honestly, it hasn't been a major issue. My oldest patient is 94, and she did great. Youngest patient's 14. Now, I will say this: if you're still growing, and typically women between the ages of 0 to 18, men up to 21 have a ton of physiologic activity taking place inside their body. And what we're trying to do, again, I share this with my patients, my goal for the more mature individual is to mimic the environment within their body that they had when they were growing, because we have these brand new repair systems that jump on injury really well. And because we're still growing, when we have injury, we're adding tissue so that injury may not be as big down the road. Right? So a big tear may be a small tear by the time you're done growing. That's kind of the advice I give.
Okay. So let's say that you could have a billboard that people would actually see. There might not be quite as much traffic as what we have had before in the past, but you could have a billboard like somewhere in a major location that really talks about regenerative medicine and your practice. What would you put on it in order to be able to inform them?
Oh my. What would I put on it? Oh, probably the same thing that's on my license plate: regenerate. Repair, right? Don't surgerize, repair your tissue. Wow, that's a good one.
So I know you're going to walk this delicate element, but when we talk about surgery, you know, there are repairs that take place when we talk about shoulder components. And we also have within our network surgeons that do a blend between the aspect of surgery and regenerative medicine. Can you comment, though, on traditional surgical type treatments where we think that there's stitching that's occurring and we're repairing meniscus or we're repairing these various different elements, but there are differences between regenerative medicine and some traditional surgical procedures that's not always well understood. Can you comment on that?
Yeah, I can. And let's just take, because I don't want to be too verbose, but let's just take the most common thing that I treat, and that's the knee. What's the number one surgery performed in the knee? Partial meniscectomies. People get their meniscus cut out, their shock absorber.
Dr. Jackson, Dr. Jackson,
Yes,
I'm
sir.
sorry. Meniscus. What is a meniscus?
Oh,
Break
I
it
was
down.
going
I'm
there.
sure
It's
I'm
shock
sure our
absorber.
viewers
Yeah.
watch,
I
but
don't know.
understand, but just for everybody so they can make sure.
Yeah. So that's kind of an explanation, but you need your shock absorber. Wish I had a knee here in my office. I have everything but that. But it is the piece of fibrocartilage that sits between your femur and your tibia, right? So that little buffer. And people tear it all the time, especially in sports. And when they go to surgery, typically it's going to get cut out. And it bothers me that it happens in the very young, because we know from the research that 86% of the people that undergo that surgery will be bone on bone within 1 year. Same thing with ACL repairs. You know, when you change the biomechanics in a knee, you're going to put more stress on parts that shouldn't be stressed, and things are going to break down. ACL is another really good example. So when that ACL is, yes, there we go. Thank you. There's the meniscus, is the blue, absolutely. That's your shock absorber. And so when that's torn, you want to keep it. We want to repair that. We don't want to cut it out, because I don't want you to be bone on bone. And I've had that surgery twice. I went in, they took it out, and then they went and cleaned it out, and now I'm bone on bone. And I was told the second time, you're going to need a total knee. Well, no, you're not. Same thing with the ACL, as I was alluding to. Thank you. Staff, help me out. I got a knee. So if you change the biomechanics with the ACL, for example, that thing is sitting in the body. It's deep in here in this kind of a position. And when they surgerize you, they're going to put it in a more upright position, which is going to create more shear force across that joint. So you're likely to tear down your meniscus, likely to re-tear the ACL. You're going to have arthritis in that knee down the road. So it's the big difference is that we are repairing tissue. We are trying to keep your biomechanics the same. We want to keep your anatomical structure the same. You were given that structure because it was the best possible structure for you to function. And I heard you say in your intro, it's all about improving function. We want people to function normally in society, right? We want you to be pain-free. And it doesn't always happen after surgery. Oftentimes, the wrong thing is surgerized. I can't tell you how often I hear that surgery or that story as well. So that is the biggest issue. We're not taking anything out or repairing it. We're letting your body repair it naturally. And that's how you do better long-term. That makes sense.
Okay. So to this end, we're going to talk real talk like we've been talking, right?
Love it.
This
Yes,
is
sir.
the fact of the matter. If anybody tells you that they've never failed, then they've never done anything, right? So
Absolutely.
much like anything else, regenerative medicine has its limitations. What are some of the things that you've quote unquote failed at or haven't been able to get benefit from?
I don't like that word, real talk. I have, okay, maybe I've had a couple failures, but hips just don't respond as well. So I turn away hips. If you're above the age of 55 and you're bone on bone, I'm not likely able to benefit you. More advanced arthritic change that has been present for more than 5 years is something that I kind of shun as well. So when I'm doing a consult and I'm talking about your candidacy level, like I said, I see a lot of these. 3 things tend to step out or jump out at me to make you a better candidate. So if you haven't had steroid injections, you haven't killed a lot of tissue, better candidate. If you haven't had surgery to remove a vital structure in the knee, a meniscus, or an ACL, or anything else that you need, that makes you a better candidate. And more importantly, if you have had your pain for less than 5 years, and I'm talking about bad pain, because there are a lot of people that have intermittent pain 10, 15 years, but then all of a sudden it gets to the point where it's so bad they want to chew that limb off. That's when the clock starts for me. And so if you've had pain for less than 5 years and you meet those other criteria, then typically you're going to be a pretty good candidate for what we do.
So what are some of the unique skills that are personal to you that you feel like have helped you be successful in being this type of physician and being able to provide value?
Well, I'm kind of a sports addict. That helps. You know, I've had a lot of the conditions that I treat, the bumps and bruises, strains, sprains, having played sports myself. Um, and it goes back to my upbringing, honestly, and my ability to articulate what it is that I do and how it can benefit you. Just talking real talk. It's probably one of my strongest suits. We talk about this all the time. The physical therapists that I work with, and why do people gravitate to this practice versus another practice? And I think it's, some people call it the it factor, right? I like people, and I truly am here to help, and people get that, right? I'm very passionate about what I do, and I derive more benefit in my day by helping others than almost anything else that I do during the course of my day.
Okay, so we got a few questions coming in, so, which I'm going to kind of summarize. Basically, in hearing kind of that context of what we were just talking about, some of our viewers are asking, so it won't help any degree of arthritis and it won't help any degree of chronic
No,
pain?
that
Can
is
you
not
give
true.
us some understanding about that?
I can. Let's use my model. I love my model, and you can see I use it quite a bit because I've torn up my normal knee, and I don't treat normal, so we'll just get rid of it. I like this model because it really helps me explain what we do. So, mild arthritis. I don't know if you can see a little nicks and dings here in the cartilage. Or arthritis being thinning or loss of cartilage. Moderate arthritis. This is my knee, bone on bone here on the right, and then severely arthritic. I can treat all of these, and I have. The key over here, and same thing with the hip, is I want to hear that you've had your pain less than 5 years. Oftentimes, your pain may not even be the arthritis that shows up on that x-ray. That's why I was saying earlier, x-rays start the story, but they don't tell the tale. It's extremely important to do a good history and physical exam, because I can't tell you how many times this knee or this knee walks into my office and I do not use stem cells. And it's normally bone on bone when we're going to start to use stem cells. But if it's determined from my history and physical exam that your primary pain generator, for example, is a meniscus tear, and I have an 83-year-old patient that, just like this, and I didn't even want to touch his knee when I looked at the x-ray. I was going to send him out until I got the history and I did the exam, and I realized it was a meniscal tear. We injected his meniscus with platelets, and he's doing great. So yes, we can treat arthritis. It just depends on how long you've had it, how severe it is, and uh, that we'll discuss during the consult. But I have turned away some folks that were too
Okay,
far along for me.
so you're doing this regenerative medicine practice, working through Regenix Network, you're helping people, doing things that you didn't think you would necessarily be able to do when you started thinking about doing physical medicine and rehab.
Mhm.
What would you have told yourself if you could travel back in time at 18 years of age? Now, hold on, we're talking in a professional context. Let me be
Yeah.
clear that of what
Okay.
you should do,
Because I was young and dumb at
provide
that time.
value, and what makes sense. So, can you give us ideas about what you would have done to tell your younger self this is what you need to do in terms of how it would be able to be impactful?
Oh, same thing I tell my patients now, but I didn't know then is, when you have an injury, don't go rush to ice it significantly early on, and don't take these non-pain medications with anti-inflammatories. Um, and then take better care of your body, maintaining better flexibility, because that is my issue, is that I just hated to stretch. And I'm suffering as a result. I need to come see you for my back, quite honestly, because of that issue. But those are the things. Just take better care of your body, eat properly, right? Put the right nutritional things into your body that help you create the building blocks for self repair. Um, all those things are so incredibly important. The little things. I tell my patients all the time when see them walk in with worn down shoes, everything starts at the feet, right? If you're going to stand and walk, you better put on some good footwear, and don't wear them too long. Don't let it break down too long. So just taking good care of yourself um, is extremely important, because when we do, we're better able to self repair.
Okay, that makes a lot of sense. So, um, let me ask you this. When we talk about how regenerative medicine can impact things 5 years, 10 years, 15, 20 years going forward, um, it's hard to speculate because we never know. I think a lot of things that are going on right now in society is a pretty good indication of that, of all the different things that we didn't know was going to take place and really kind of take a different turn. But outside of that aspect of the cartilage growth that you made mention of, do you see that regenerative medicine is going to have some degree of uptick compared to where it is currently? Now, clearly, we may have a bit of a biased view, but I think there's a lot of kind of signs that sort of suggest where this may go. Can you comment on
I think so. I do believe that there's going to be a major uptick, and I think COVID is actually going to cause some of it. As you know, here at Regenix, we have corporate clients, those large self-insured employers that pay their bill, their insurance bill, have directed their insurers to cover this procedure. And we've had success, tremendous success. And the more success we have, the more word of mouth gets out, the more people are clamoring to be a part of this. I have an opportunity to have medical students come through from Des Moines University. And I think that grassroots effort is so incredibly important. I believe that when they come through here, it's important that they see the benefits of regenerative medicine because they're going to be the ones making noise in the system. They're going to be the ones saying, you must give me the opportunity to treat my patient this way. I'm not going to continue to put medications into their bodies that are hurting them or manage a condition long term that I know we can resolve. And so that is what needs to take place. But when it does, this is going to be covered. It's just like everything else that's new, right? I guess when they were doing heart surgery and they wanted to go to cardiac cath, everybody was in an uproar about, oh, no, you can't do it that way. Well, yeah, you can, as we see now. And this is going to take the same, go the same route, take the same path.
Okay. As we start getting closer to wrapping up, we have about another 3 or 4 questions that I want to pose. Let me just kind of get this right off the bat. Is there anything else I should have asked you about that I didn't, that we want to make sure that we hit a passionate topic that you can provide to our values so they continue to get value out of the context of this conversation?
I think you asked very good questions, quite a few. The take home point for me is that natural healing is the future of medicine. We all have the ability to self repair. As long as you're living and breathing, you have blood flowing through your vessels, you have the ability to repair tissue. And medicine should be practiced in a manner within which we exhaust all conservative efforts before we move forth with a more invasive or last ditch effort. And that's why this is extremely important. It gets skipped over all too often where you go from 0 to 100. And when I'm talking about a simple steroid injection to a total joint replacement with no conservative intervention in between. This is going to fill that gap. It should fill that gap. And that's the take home point. Seek it out. There are people in your communities that are doing regenerative medicine, but ask the right questions, right? You want doctors injecting you, doctors that have good training and know how to utilize ultrasound and fluoroscopy to guide that needle precisely. So you don't just want to fall into anybody's office and undergo one of these procedures because you could end up with a pretty bad outcome or become a statistic.
Okay, so without speaking negatively towards anyone, you've mentioned those pieces of having an understanding of selecting patients appropriately, number one. Number two, understanding the biomechanical model and how symmetry affects other areas of the body, how neurologic components impact things that can sometimes be somewhat hidden and occult. And you really need that diagnostic skill set to be able to put it together, along with the ability to be able to implement it by using image guidance. But as we know, there is growth of non traditional healthcare providers within the realm of regenerative medicine, many of which have a very strong connection with the patients that they take care of and their clients. Um, what value do you feel, if any, do those providers have within the context of treatment? And you stated that patients really need to be concerned because of some of those things that are in place, right? So those things that are in place, they very well may not be found at these other locations. Do you think that it's a normative piece that other healthcare providers do some of the things that we think are a primary um, almost need in order to be able to treat a patient with the best outcome?
Do I think it's normative? Yes and no. I guess it depends on who that individual is. And what especially is, I know you don't want me to be specific, but we are all faced with competition from folks outside the allopathic or the osteopathic world. And um, They do hold some value. That was the first question you asked. I think that the value they hold is that they are bringing light to the subject, right? So they are holding seminars and people are interested in regenerative medicine and they're showing up and hearing about stem cells and platelets. Now, they're not always hearing accurate information, but my hope is that educated slightly means that you will seek out a higher level of education. And when doing so, typically you'll run across um, someone in our network or a network that's similar to ours. So, and it's
Okay.
not normative for everybody to do it, though, right?
All right. I'm just going to say
Okay,
you handled
cool.
that really well, particularly with your Flint and Michigan background. That was very politically done with some degree of adroitness and articulateness that was very smooth, shall we say. But
Right?
the thing that I was going to ask you is, so you make a reference to resources. What are some
Mhm.
of the resources that patients can look for, not just within our network, but just in general, to be able to say, now I'm starting to kind of get this regenerative medicine shtick and how it can be impactful to me.
The easiest way for me to point people in the right direction is to point them to the Regenix website and go to the blog. And because I think Dr. Centeno does a great job of in his blogs, when he talks about something, if he talks about an ACL repair, if he talks about partial meniscectomies or an orthopedic surgeon, there is a hyperlink in that article to that information. And that's what I tell people. Don't read his words. Don't worry about his words because they'll read and say, "Oh, this is Regenix bias." Go look at the research, and I can help you get to that research very easily. And that's a great resource, one of my favorites to share with people. Um, and then also just talking to other physicians. Unfortunately, it's changing. I was going to say a lot of the primary care physicians don't always speak highly of what we do, but honestly, in my area, it is definitely changing because they're seeing these patients back in their office after they've been treated and they turned down surgery and they went with a regenerative medicine option and they're coming back with great outcomes. And so I'm actually happy to see that change. I've even had a couple orthopedic surgeons recommend that people come and look at what we do. So things are changing, improving for the better.
So, last two questions. First, where can people find you online and be able to connect with you? Can you tell us a little bit about that?
Yeah, I'm on Facebook, but that's probably not the best way. Just Regenix Des Moines. If you go to the Regenix Des Moines website, yeah, you can go to the about us or the providers, and if you email me there, it'll get to me. So I would recommend people ask questions. If you're thinking about this at all and just a little concerned or a little confused, don't know exactly if it's right for you, reach out via the website and we'll answer your question or give you a call. I have no problem with that either.
Okay. So, as I understand it, from a Regenix standpoint, there are resources that are able to track and trend and give insight into your particular problem, whether it's a knee, an ankle, a hip, a shoulder, a neck, a low back, that can be able to pool data. Can you talk to a little bit about that?
Yes, I can. It's the registry, the Regenix registry, and our practice doesn't do a great job of getting information into the registry. We do as good a job as we possibly can, but what we attempt to do is track all of our outcomes. So, prior to getting an injection, you'll receive an email that asks you a bunch of questions about your function and your pain level prior to the procedure, and then during the course of your recovery over the next year, I think it is that they will send you emails on a regular basis to get your feedback. That has been a great source of information for the patients because they want to know, does this work or not? And that is very valid information. It's out there. I actually um, do my own internal tracking. So Jason, who works with me, the athletic trainer, who's my physician extender, puts together this little spreadsheet. So we know what kind of success we're having here in this practice compared to what Regenix is doing nationally or internationally for that matter.
Okay. Thank you so much, Dr. Jackson. Before we kind of get to our final question, I really want to thank you from the bottom of my heart for coming onto our channel, explaining regenerative medicine, which is something that you do incredibly well. You've been doing it for years and are just a foundational member in the community of regenerative medicine, which sometimes is not given as much degree of notice and credit as what you do. And have been actually influential to myself and my practice to really help us be able to kind of define and make decisions about what we're able to do and offer our current patients within our own area. I just wanted to thank you in that regard. But one of the things that I wanted to pose to you, and so this is kind of our pinnacle question. This is the one that people are like, "Ooh, you kind of saved this one for the end." We're throwing a Hail Mary here. Is the following: is so if you can look back on this 3 years from now, what has
How many years from now? You said 3 years? Yeah.
Yes. What has to have happened for you both personally as well as professionally for you to feel like this has been a successful time for you?
Personally, it's tied in, honestly. I don't think I can separate the two because professionally, I'm here to help. I've wanted to be a physician since the age of 6, right? And I pursued this dream a long time, long and hard. And the goal at the age of 6 was to help people, right? I just want to continue to grow this practice, continue to grow, support the growth of the regenerative medicine field so that we have more options for people. We're treating more conditions. And if there is continued growth and we get more insurance, reimbursement, insurance coverage, I'd be happy as a lark. It would just allow me to continue to do what I love doing. I don't feel like I work. I don't feel like I have a job. This is my calling. I, I can't fix a car, right? There's a lot of stuff. I couldn't build a house, but I can do this. And so just allowing me to do what I love doing and see the growth and me contributing to the growth, that's what would make me happy personally and professionally.
Okay. Thank you so much. Definitely appreciate you being on with us.
And season tickets to Michigan State. That would make me happy too.
Okay. So I'm going to tell you, I was trying to make sure that we didn't have any digs, but to be quite frank with you, particularly living in South Bend, Indiana, the aspect of Notre Dame Irish, I'm pretty sure there aren't that many people that are really clamoring for those tickets. So I don't think you're going to have too much of a hard time acquiring them. But be that as it may, one of the things that we want to make sure that people are getting is connected with having understanding. So if you feel that this is of value, definitely subscribe to our newsletter where we give written content as well as insight about what's taking place within the context of regenerative medicine and interventional pain. And if you really want to delve into depths of these topics, on our YouTube channel will be this video that's actually kept for a long-standing time so people can be able to refer back to it and be able to use this as a resource for how to be able to understand regenerative medicine, as well as other aspects of things like PRP, stem cell therapy, alpha-2 macroglobulin, components of other different type of cellular type of treatments. So by all means, check out our YouTube channel and subscribe, and know that we're doing this every Thursday at the same time, 4:30 p.m. Eastern, to be able to give insight, to be able to help you punch pain in the face, get back to doing what you deserve and what you love. Thank you so much for joining us, and tune in next week and we'll have another video of a similar element, being able to talk to someone about how to be able to get your life back. Thank you.
Well, thank you for having me. I truly appreciate the opportunity.
Of course.
Think we're still live? Yes, sir.
We're getting a couple thank yous from our watchers and viewers, and apparently it's trying to hold us here for us to do an outro so that we can't be able to get off, but we'll cut this stream short and go forward from there.
I was wondering if we needed to do an encore.
It certainly seems like it. It's trying to keep us on.
I don't sing and dance. I got the name, but none of that other talent.
Yeah, you didn't come from the right state either. I mean, if you're from
Indiana, man, here we go again.
That would be a different story.
Yeah, here we go again. You're close to Gary, Indiana, so
There you go.
I just,
Exactly.
yeah. That man made my life miserable, I will tell you. The first 20 years.